Cleaning and infection control, making a difference. Hospitals should do the sick no harm, but even today, 1 in 10 patients admitted to hospital will acquire an infection. These range from the trivial to life-threatening. More patients die, though, from hospital-acquired infection than from road traffic accidents in the UK, with many of the deaths being avoidable. Cleaning is core to preventing infection, ranging from washing hands, cleaning the ward environment, through to sterilising surgical equipment. High standards of cleanliness protect patients, relatives, staff, and visitors alike. To understand more about bacteria, this slide shows a human hair highly magnified in cross-section. A white blood cell is roughly a quarter of the width of a hair. The yellow dot is the equivalent size of a bacteria. It requires 200 bacteria linked end to end to cover the width of a human hair. If we zoom in closer, we can see an artist's impression of what bacteria look like, and this will be used to represent bacteria for the rest of the presentation. At the end of 2011, 4 premature babies died in Northern Ireland from infection caused by an organism known as Pseudomonas. The source of the infection was found to be water taken from taps to wash the babies. By taking samples, it could be shown the Pseudomonas was living on the end of the tap. The question then arose as to how the organism found its way to contaminate the end of the outlet. One route, which is important one, is connected with cleaning. The drain from a hand wash basin is connected to the main sewer and is inevitably highly contaminated with bacteria. When a cloth is used to clean around a sink, especially near the drain, it will pick up large numbers of bacteria. If this is now used to clean the end of the tap, bacteria can be transferred from the cloth to the tap, where they can then establish themselves. Here we can see a range of bacteria are living at the end of the tap. A problem arises when staff collect water to use on patients from a contaminated tap, as bacteria will be flushed out with the water as it runs out of the tap. If this water is then taken to be used on vulnerable patients in the hospital, the bacteria may reach the patient and, in the case of a premature baby, can break through into the bloodstream, causing infection and eventually killing the baby. When a tap is found to be contaminated with bacteria, the device shown in this image, a point-of-use filter, may be fitted to make the water safe. If we look inside the filter, we can see how it works. There is a membrane with very tiny holes in it, which water molecules, being so small, can pass easily through. However, the much larger bacteria cannot pass through the filter and are held back, ensuring the water is safe to use. Poor practices can make the filter ineffective. Although bacteria is still held back by the membrane, if contamination is introduced at the base of the filter, when water flows out of the filter, bacteria will accompany it. What can be done to minimize risk when cleaning? We know the most contaminated areas are the basin, especially in proximity to the drain. What some may find surprising is the tap handle is also dirty because people use their unclean hands to operate the tap. So, how should you clean? Using a fresh cloth, the end of the tap should be cleaned first, followed by the rest of the tap, cleaning the handle, which is the dirtiest, last. For the sink, the top surface should be cleaned first, and then the interior of the sink moving towards the drain area last. So, to summarise, in hospital we have a particularly susceptible group of patients, spanning all ages from premature babies on a neonatal unit to elderly patients on specialised units such as high dependency or critical care. To minimise the risk of waterborne bacterial infections, please remember 2 things. Number 1, clean the end of the outlet first with a clean cloth. And number 2, the advice in this hospital is if you see a point-of-use filter in place, do not clean the filter. You can clean the tap as normal. By following the simple guidance, you will help protect the most vulnerable patients in the hospital. Hospitals are frequently seen as being run by doctors and nurses. However, the hospital could not function without the commitment of other staff groups, including domestic staff and cleaning staff, who have a vital role in protecting patients. As Florence Nightingale said in 1863, the very first requirement in a hospital is that it should do the sick no harm.